On this evening's Two on Your Side Town Hall, a lot of you watching right now have friends, family, maybe even property over in Canada. An update tonight on the border closure.
Plus, if you are looking outside the area for your vaccine appointments, you're not alone. We're answering some viewer questions about that tonight.
And the Sabres have not yet revealed their plans, but some fans are allowed into the stands starting tomorrow. We're going to discuss that with somebody who's keeping track of what other arenas in the state are doing.
And good evening, everybody. One of the pandemic restrictions that we've talked a lot about here on the town hall is travel at the border with Canada. The border closure was just extended and will now last through March 21st. Essential trade and travel is allowed to continue.
Yeah, get this. Canada is now requiring negative tests for residents who are returning to that country at the land crossings. There are some other new restrictions as well. And the issue of all of this is sure to come up during a meeting tomorrow between President Biden and Canadian Prime Minister Justin Trudeau. Joining us live right now to talk about all of this is immigration attorney Rosanna Berardi. Rosanna, it is always great to see you. Walk us through this, if you can, about what is new at the border. I mean, the big thing for those of us who have been following this is that, you know, the land border is still closed. We still can't get over there, right?
Yeah, great to be here. Unfortunately, I wish we were talking about the border reopening for all, but we're not. So we've learned that the border will stay open, not to really anyone's surprise. I'm sorry, the border will stay closed, not to anyone's surprise, until March 21st. Canada's really clamped down on entry to their country. They're having tremendous problems getting vaccines. They're just having a really hard time containing COVID. And as a result, even Canadian citizens returning to their own country have to show negative COVID tests, not rapid tests, the PCR tests. And if you're flying into Canada, you have to remain in a hotel for 3 days on your own dime. So Canadian government's really clamping down on this. And unfortunately, I don't expect that to change anytime soon.
And you mentioned this a little bit, but what do you think is going to need to happen before some of these travel restrictions are finally lifted?
So I really think we're not going to see any movement until Canada gets a good hold of vaccine distribution. I mean, we're obviously struggling with it in our own country, but we're getting good news. I mean, today we're hearing that the COVID positivity rate in Western New York is 3%. That's great news. Canada, unfortunately, isn't getting that type of news. And until they can really start doing vaccinations, I really think we're going to see these super strict requirements.
Yeah, and you mentioned it is really interesting now that people who are flying into Canada have to do that 3-day quarantine inside their hotel room, because that was a way that some people were kind of getting around the rules at the land border, right? They were just choosing to fly. So we heard stories of people here in Western New York, for instance, flying all the way to Toronto and then maybe driving just across the border so that they could see someone that they wanted to visit. And now if you do that, you're going to have to do that 3-day quarantine inside the hotel and then test negative and kind of go through all of that. Anything else to add on that? And let me tack on this question. What are you going to be watching in terms of this meeting tomorrow between the two leaders of these two countries?
So it's interesting because every time a new rule comes out, within 24 hours, somebody creates a workaround. So the workaround for the Canadian citizens that are in the U.S. and maybe want to fly home for the Easter holidays, to get rid of that 3-day quarantine, they're flying into Buffalo. And they'll have their COVID negative test with them, and then they're driving across the border. So there's all these little loopholes being created as all this rolls out. In terms of tomorrow, super interested to see what goes down between President Biden and Prime Minister Trudeau. I'm pretty certain that Canada will be asking the United States for their help in securing vaccines. They are at a really, really tough position, crossroads right now. They can't seem to make any headway. And as I said earlier, we're having our challenges in the U.S., but it's happening slowly. So I don't think we're going to get a border announcement tomorrow. I think as Canada being our neighbor, our partner, we've always worked historically well together. No one ever wanted to see this border closed for coming up on a year. It's unprecedented. It's killing both sides of the border economically. It's affecting personal relationships. So I'm thinking that conversation, if I was a fly on the wall tomorrow, would really be, how can the United States help Canada to really solve their problem?
We wanted to ask you something sort of separate from the COVID situation as well, because the new Biden administration has made changes to the U.S. immigration and refugee policy. We're wondering how these changes could impact Western New York.
Yeah, super interesting. So the Biden administration reversed the Trump administration's policy on refugees and having to wait outside of the U.S. while their claims are pending. They can now wait inside of the United States. So there's an estimated 25,000 refugees, asylees, coming to the United States. Raises all types of issues with COVID. Are they being tested? Are they not? Um, Ultimately, will they go to to Western New York? Absolutely. We have a huge refugee population, Burmese population, and others in the Western New York area. So expect to see that in the coming months.
And then at the same time, you now have this proposal actually written down, right, from the Trump administration last week to overhaul our country's immigration system. We talked about this, what was it, right before Christmas, I think, the last time that you were on. And I think you said, like, for your Christmas present that you wanted, comprehensive immigration reform, or wanted Congress to actually kind of step in as opposed to these presidential actions, right? Any more hope on your part that this could get done?
So, okay, the good news is there's a bill before Congress called the U.S. Citizenship Act of 2021, sweeping immigration reform, comprehensive. The bad news is it's probably not going to get passed. It is a huge animal of a bill with all kinds of controversial components. And even with the Democrats controlling Congress, they're saying, all in, this probably isn't going to happen. Now, what experts are saying is they may break it off in pieces, and maybe parts of it will be passed. But, I didn't get my Christmas gift in terms of comprehensive immigration reform. And I'll just take a little piece right now. It's really time for Congress to act. They've got a bill in front of them. I don't care where you are, what side of the aisle. Let's do something to change these broken immigration laws.
Yeah, and it takes 60 votes in the Senate to pass something like this. And so that's where you get this bipartisan nature, which that's the only way you can get something that's lasting anyway,
Sure.
right? Get buy-in from both sides. So we will follow it closely. Immigration attorney Rosanna Berardi, thanks for your time. It's good to see you again.
My pleasure.
It's good to see you. Moving on now, ever since the peak of this latest wave of the pandemic last month, we've seen a pretty incredible drop in most coronavirus numbers. Yeah,
right now what we're looking at are hospitalizations. Since then, we've gone from having, you can see, more than 500 Western New Yorkers in the hospital to right now we're about half of that, around 250.
And the rate of positive tests has dropped sharply as well. We were hanging out above 8% just a few weeks back, and now we're less than half of that number as well. But one number that cannot go down is the death toll.
Yeah, while the number of deaths per day, the rate is dropping around the country. We hit a very grim milestone over the weekend.
NBC News senior medical correspondent Dr. John Torres talked today about why there is hope despite that.
The U.S. has surpassed 500,000 deaths. That's 500,000 deaths from COVID-19. And even as Dr. Fauci has said, this is nothing like anything we've ever been through in the last 102 years since the 1918 influenza pandemic. But there is hope on the horizon, as a new study is showing our behavior is slowing the spread of the virus. So things we do like hand sanitizing, staying home, and not eating out as much are certainly helping. Plus, we continue to see hospital cases fall to less than 57,000. That's the lowest number since November 7th. Now, we will beat this virus, but it bears repeating again and again, we can't let our guard down. Those case numbers could jump right back up if we aren't careful.
And the Biden administration announced today that flags at all federal buildings will be at half staff for the next 5 days in memory of those 500,000 people lost to COVID.